Welcome, and with me today is Dr. Cathleen Gerenger. She is an amazing practitioner. I had the honor of meeting her at the Tampa VIP dinner. Just such a wealth of information, and she's going to be talking to us today about hormones simplified. So Dr. Cathleen, thank you so much for being here. We are just thrilled to have you. I'm going to step back and just let you take it away.
Thank you so much for having me on. We will be talking about a subject that I absolutely love, all about hormones. So I'm going to simplify it as much as I can. I just want to introduce myself a little bit. I want you to get to know me. I am a chiropractic physician, and I am also a certified acupuncturist. I received my doctorate at the age of 24 and opened my first private practice at the age of 27. So 25% of my patient base are mostly conventional healthcare providers, such as medical doctors, specializing in emergency room medicine, internal medicine, orthopedics, oncologists, and nurse practitioners. And the rest of my patient base are a mixture of local community patients and also social media followers and professional athletes, especially the pro golfers. My hobbies include golfing, spinning, weightlifting, hip hop dance, cooking, and sewing. So I'm pretty active. And my claim to fame include that I am a cover girl for a book title called Weeping Under the Same Moon, written by John Elias. And I am also a hand model for Public Supermarket. I am also featured as a health and wellness expert with a company called Utis. You probably see my face on HSN, QVC, and on infomercials throughout Hulu and other streaming platforms. So that's all about me. Let's keep on moving. Well, what really brings me joy? Teaching, training, speaking brings me joy. I have the ability and the chance to actually travel overseas and speak and train MDs from 10 different countries on hormonal medicine, regenerative medicine, and also mind medicine. So being active on social media also brings me joy. I am very extremely active on social media. So make sure you connect with me and follow me on Facebook, Instagram, TikTok. So let's start with our presentation. What are hormones? Hormones are chemical messengers that have a huge impact on the body. They travel through the blood. They cause changes in the organs and tissues in your body. They work in a lock and key fashion. Hormones. What parts of the body do they influence? If you look at the chart, they influence everything from our hypothalamus to our pineal gland, thyroid and parathyroid, which makes T3 and T4 and calcitonin and the parathyroid hormone. Also, our pituitary gland that makes TSH, FSH, and vasopressin. Our liver, IGF, thymus, which is our immune system, adrenal glands, kidneys, testes, stomach, pancreas, ovaries, and the placenta, and also our uterus. So around the age of 25, our organ starts to produce less hormones. The first hormone starts to decrease is your thyroid, then your progesterone, then your testosterone. These hormones decline as we age, such as growth hormones, DHEA, melatonin, and pregnenolone. Unfortunately, the insulin resistance hormone starts to increase, such as insulin, cortisol, and estradiol. Thyroid, the feel-good hormone. So every time when I talk about the thyroid is so important because it makes you feel good. Always tired. So what does our thyroid do? Thyroid function. Thyroid gland produces a hormone that regulates the body's energy and metabolism. It regulates your body's heart rate. The thyroid hormone influences every cell tissue and organ in your body. And it sits right over here. Thyroid deficiency. You can actually walk around and screen people on the street or screen your patients to see if they have a thyroid imbalance. So the first thing is a pale face or puffy eyes. Hertog sign, that means it's the missing third, the outer third of your eyebrows. I have the pleasure actually meet Dr. Terry Hertog, and he taught me a lot about the thyroid. He is from several generations of endocrinologists. So his great-great-grandparents or granddad actually named that. So hair loss, brittle nails, swollen lips, swollen tongue, dry skin, elbow keratosis, that means that the elbow gets a little bit dry, yellowing of the palms, the hands, and feet. Behavior, fatigue, slow. I grew up in New York City, and when I moved down to Florida, oh my gosh, everybody was just so slow. So slow, weak, anxious, brain fog, depressed, poor sense of well-being, hyper-agitated type A personality. Physical symptoms of a thyroid imbalance: muscle aches, joint pain, scoliosis, yes, chiros, hyperlordosis, swollen ankles, flat feet, constipation, bloated, stubborn weight, obese, always feeling cold. So if you're the one that's with that sweater in that room, you have a thyroid imbalance. A knee patella reflex delay. That means that if you do the patella reflex, their knee probably like huge delay into the to the reflex. I always joke around. It's like the next day, then they start to feel it. There's 3 types of hypothyroidism. There's the primary, secondary, and tertiary. The primary type of hypothyroidism means that the production of the thyroid hormone decreases. So you really have to pay attention to their subclinical signs and symptoms. So secondary thyroid problems, hypothyroidism, poor conversion of T4 to T3. T4 is the inactive form of thyroid. T3 is the active form of thyroid. And number 3 is tertiary, the receptor site insensitivity. We'll go into it in just 1 minute. So primary, so the production of your thyroid hormone decreases due to the lack of iodine and thyroid glandular. Secondary, again, the conversion of T3 decreases. T3 is our metabolic machine, our bioavailable thyroid, our thyroid that actually helps us with our metabolism. So because of the endocrine disruptors, that must be detoxified. The conversion occurs, of course, in the liver and the gut. What does that mean? That means if your microbiome is not up to par, or if your liver is full of toxins, that conversion does not occur. Tertiary hypothyroidism, receptor site sensitivity decreases due to, unfortunately, aging. When we age, our body actually exposed to more toxins. So it's resulting from food or environmental. So it's really important for us to actually detoxify our body at least once or twice a year. I do it. Let's talk about the thyroid assembly line. Well, my doctor said my labs are normal. Most of my patients, they come in, they've seen about 5 different specialists, and I'm pretty sure you experience the same. So the pituitary gland, which is located in our head, it sends a message to our thyroid stimulating hormones. Thyroid stimulating hormones sends a message to our thyroid gland. Thyroid gland produces T4, which is 80% of your thyroid hormone, and T3, which is 20% of your thyroid hormone. And then the thyroid hormone, T4, T3, goes throughout your body, your tissue, your skeletal muscles, everywhere. So why does most provider miss normal versus optimum? So for a functional medicine physician or somebody that's in the holistic arena, what we want to do is that we want to look at optimum levels. For example, TSH, the normal range on a laboratory test shows 0.5 to 5.5. Optimally, I like their TSH to be between 1.0 to 2.0, depending on their age. T4 free, which is our inactive form of thyroid, 0.8 to 1.8. I like it to be greater than 1.5. T3 free, 2.3 to 4.2. I like it to be greater than 3.5 to 4.5. I'm approaching my 50s, so I'm pretty vain. I want to make sure my metabolic machine is working. So I like that T3 to be greater on myself, to be greater than 3.5 at least. When we talk about iodine and when we talk about T3 and T4, T4 means there are 4 molecules of iodine attached to that thyroid hormone. If you look at the picture, you actually can see the 4 molecular structure of iodine attaching to it. And T3 means 3 iodine attached to that thyroid hormone. Remember our periodic table? We talked about receptor cells and the insensitivity of these receptor cells. So if you really look at the periodic table, iodine are what we call halogens. So you have fluoride, chloride, and bromide. They compete with the receptor cells of your iodine. Fluoride, we find it in our water, in our toothpaste. Chloride, swimming pool, water. Bromide in plastics. So that's why your receptor cells gets pretty insensitive, and above that, your liver is exposed with all these environmental toxins that inhibits that conversion to occur. Fluoride, and then there goes your iodine. So iodine, let's talk about iodine. Iodine is responsible for the production of all the hormones in your body. Every cell in the body contains and utilizes iodine. That is so important to understand. The thyroid gland contains a higher concentration of iodine than any other part of the body. Your body does not make iodine. You can only get iodine through food. And if you eat like me, I eat a lot of sea vegetables. I eat a lot of seaweed. My diet's a little bit different from the norm. Let's talk about factors that cause the inability to convert T4 to T3. So if you look at that circle on the right, factors such as aging, alcohol, diabetes, fluoride, chloride, bromide, mercury, stress, obesity, pesticides, and surgery. Factors that cause an inability to convert T4 to T3. Nutrient deficiencies, chromium, copper, iodine, iron, selenium, zinc, vitamin A, B2, B6, and B12. Selenium, if you eat 2 Brazilian nuts a day, that'll give you the selenium that your thyroid actually needs for that day. Let's talk a little bit about monitoring the thyroid medication. Because I have a functional practice, we watch the thyroid, the TSH, and T3 and T4 very closely. You never ever want to suppress somebody's TSH. We'll get in big, big trouble. So we have to make sure that we provide educational stuff on thyroid medication. Like we educate our patients when to take it, why you take it, and signs and symptoms to make sure that they're not overcorrecting their thyroid. So with thyroid, we really like Armour Thyroid because it's been around for a long time. So you should take your thyroid medication every morning. I usually say take it about 20 to 30 minutes before you eat, depending on that particular patient. Some patients, they have really bad absorption issues, so they might need an hour or two before they take the thyroid. So we look for signs and symptoms when our doctors are overcorrecting thyroid. That means if you stick your hand out and if you start to shake, those are tremors. That means that maybe your thyroid meds is a little bit too much for you. So we make sure we back off. Or heart palpitations, hair loss, etc. And also when a patient is on a new thyroid medication or when a provider changes the thyroid dosage, make sure that you remeasure the thyroid. Your TSH, T3 free, T4 free must be remeasured within 3 months. And again, if the dose is increased, make sure you document that. No heart palpitations, no tremor, just to make sure that we're pretty kosher with everything. So let's move on to progesterone. Progesterone is the mood stabilizer. That's kind of like my Zen hormone. Progesterone, it's produced in our ovaries for women and adrenal glands. It regulates the monthly cycle. It prepares the body for conception and pregnancy. So anytime when I hear about miscarriage or infertility, immediately I think about progesterone. It plays a role in helping the body's sleep cycle. It also helps with anxiety and has a common effect on the body. So most of the time when a patient is placed on Prozac, we tend to see that they probably have a low progesterone in their body. So after we correct their progesterone, suddenly they get weaned off of Prozac by their psychiatrist or by their internal medicine doctor. Progesterone also protects us against uterine cancer. It prevents breast carcinoma, prevents osteoporosis, prevents fibrocystic diseases. It also protects against cardiovascular disease. Most of the time, we hear this all the time when a prescription is called in for progesterone. Patients get confused because sometimes the pharmacists that are not in the integrative world, they call it progesterone, compounded progesterone. There is a big difference between natural progesterone versus synthetic progesterone. So if you look at the molecular structure of the natural progesterone, you don't see the additional, what we call the molecular structures of other things that's connected to the bioidentical progesterone molecular structure, such as Provera. So natural compounded progesterone resembles the bioidentical, the molecular structure that your body makes its own natural progesterone. Provera is a progesterone that is synthetic, which does not do that lock and key. It does not resemble your body's molecular structure. Let's move on to testosterone. Testosterone is our look good hormone. I am a big candidate of what I call bioidentical hormone replacement therapy. Bioidentical hormone replacement therapy study actually shows 35.5% lower incidence of breast cancer in women tested with subcutaneous testosterone. What is that? I call that pellet therapy, and we can get a little bit into it. So this actually is very exciting for me because I started out with bioidentical hormones with Dr. Donovitz all the way back in Texas. when I went to his conferences, and actually I certified my MDs and my nurse pract in practicing bioidentical replacement hormones. So this 9-year study found that women who took testosterone via pellets as part of the bioidentical hormone replacement therapy had a 35.5 lower incidence of invasive breast cancer compared to the studies that they had before. So this groundbreaking study was actually done by a BioT founder, Dr. Gary Donovitz. And if anybody have any questions or anything like that, I can actually share the publication, because he did accumulate all this data to show that bioidentical hormones actually helps us. So does this sound familiar? These are testosterone deficiencies. Extreme fatigue about 3 to 4 p.m. Like, do you hit the wall? That's why Starbucks and coffee shops, their line wraps around the block. Mood swings, anxiety, tension, irritability, sleep disturbance, wakes up about 3 to 4 a.m. Memory loss, depression, lack of focus, and brain fog. Hot flashes. Hot flashes is usually an estrogen deficiency, and night sweats is usually a testosterone deficiency. A lot of times doctors actually lump them together, but no, hot flashes, you need estrogen. Night sweats, you need testosterone. Weight gain, joint pain, bladder symptoms, frequent UTIs. Usually we see that in a lot of women that are menopausal. Migraine, severe headaches, of course, because the testosterone and the hormone starts to dip around the cycle. Decrease in sex drive or sexual performance. This is alarming. 1 in 7 premenopausal women die from heart disease. So for the postmenopausal women, that number rises 1 in 3. A lot of times when we talk about testosterone, we focus on our male counterparts and not our female counterparts. We women need testosterone too, because testosterone really helps not just with the muscle mass, but it protects our cardiovascular system as well. Alzheimer's disease. Women get Alzheimer's disease 8 to 1 over men. Women on estrogen are 50% less likely to develop Alzheimer's disease. Men with low testosterone are 3 times more likely to develop Alzheimer's disease. Listen, with Dr. St. Clair, lifespan, epigenetics, we are able to actually turn on or off our genetic expression. And of course, the next breakthrough medicine is what we call nutrigenomics, where through nutrition and supplementation, we are able to, again, turn on or off our genetic expression. That is just absolutely amazing. Arthritis. Hormones actually could ease pain. 10% of men and 18% of women greater than 60 years old have osteoarthritis. So both estrogen and testosterone can stimulate pre-cartilage cells, possibly by reversing the development of arthritic tissue. When I talk about estrogen, I use that term loosely. There's actually 50 different types of estrogen. So when I talk about estrogen, I talked about the good estrogen, which is E2. We call that estradiol. The bad estrogen is called estrione, which is E1. So what can we do? How can we protect our body? I just kind of simplify into 4 different steps. Number 1, detoxify the body. Number 2, nutrify the body. Number 3, fortify your body. And number 4, which is really, really important, the power of the mind. We always talked about proper nutrition is key, and focus on biology before pharmacology. I am blessed with a team of physicians and healthcare providers that are very, very open-minded to functional medicine and holistic medicine because they get it. So Detoxified, of course, movement. Movement helps to stimulate our lymphatic system. Get a hot sauna. It helps to eliminate toxins through sweat. Hot yoga. Of course, supplementation is key. Cleanse. I love to use what I call glutathione. Of course, there's different forms. There's liposomal forms. There's IV or subcutaneous injections. Number 2, Nutrify. You have to actually put the nutrients back into your body. You're sick, you don't feel good because something is missing. Of course, it goes down to food. So raw whole foods is really important. It helps to regulate our bowels. So the small intestine is 23 feet long. I mean, that thing is really, really long, almost like the size of a tennis court. So that's where nutrient absorption occurs. Plant-based whole foods allow our body to digest it a lot easier. Nutrient-dense foods such as reds, like beets and berries, greens, such as green leafy vegetables. Number 3, Fortify. Must balance hormones, either through pellet therapy, cream, troches, or rapid dissolving troches or tablets. I like peptides. I use a lot of peptide therapy as well. BPC 157's been around for a very long time. It is derived by the gastric juice, and it actually helps with our digestion. And athletes really love it until we got kind of banned from the athletic arena, depending on which, if it's golfers, baseball players, or football players. It really depends. Somorelin, which is a kind of like your growth hormones. CJC 1295, I love that. That actually helps to stimulate the IGF-1 and it helps to facilitate the fat loss. Oxytocin, there's a huge podcast that talks about the importance of oxytocin. Amazing. I like that too. Thymosin alpha. Unfortunately, as we age, our thymus gland kind of like disappear. So thymosin alpha is a peptide that's derived by the thymus gland, and thymosin beta 4. So cellular therapy, I love. Umbilical cord blood. We're talking about regenerative medicine here. Umbilical cord blood, cytosomes, mitochondrial organelles, and something called xenotransplantation. That I learned from my overseas doctors in Europe, Switzerland, and Malaysia. So what we want to do with cellular therapy is that we want to repair, rebuild, and regenerate new tissue. And of course, supplementation such as chrysin, DMG, which I love. Thank you so much, Nutritional Frontier, for actually giving me a book on DMG. Tripolis, DIM, NAD. I love NAD. It helps to activate my mitochondria. Again, glutathione, and rapamycin. And number 4, of course, the power of the mind. We call it neural reprogramming. I use an app called Brain Tap. I use it every single day just to quiet my mind, and I meditate at least once a day. Of course, meditation and yoga, besides golf, spinning, boot camp, community, and all the activities that I do, I really enjoy doing yoga as well. Well, thank you so much for tuning in. Again, my name is Dr. Cathleen Gerenger. Please, let's stay connected. Follow me on Instagram, Facebook, YouTube at Reprogramming Wellness, and we make sure that we include the link below. My website is www.drkathleen.com. Thank you.
Excellent. Thank you so much, Dr. Gerenger. That was so good. You really did make it simple. So I appreciate that because it's a big topic and I think people get confused. So do you take virtual clients as well?
Yes, we do. Actually, after COVID, my practice has totally just blossomed, and we take virtual clients throughout the whole United States and also internationally as well.
Wow, that's wonderful. So guys, if you need to get a hold of Dr. Cathleen, she would be happy to help you on your health journey, especially those that are suffering with hormone issues. So thank you so much for being here. And this live stream will last. It's going to be on 4 different channels, and I'll make sure that you get a copy as well for your office. So thank you so much, everybody, for joining us. And Dr. Cathleen, how would they connect with you to make those appointments?
Just hop onto my website, drkathleen.com, and you can actually schedule right there on the site.
All right. Sounds great. Okay, guys. Thank you so much. Thank you for your time, doctor.
You're welcome. Thank you.
Okay, everybody, stay tuned because we have our roundtable discussion coming up at noon on diabetes. Thanks, everybody, for being here at the Weiner Wellness Virtual Summit.